Hi everyone, this is Megan with St. Company, here to welcome you to another episode of Taking the Supply Chain Pulse. In today's episode, Fred sits down with Joe Colonna, who leads supply chain operations at Piedmont Healthcare in Atlanta. Together, they dive into the critical role of value analysis in today's healthcare supply chain and how it drives smarter and more sustainable decision-making. Joe also shares reflections on his mentor, the late Bill McFaul, whose influence and leadership left a lasting impact on the industry and on Joe's career. It's a thoughtful and insightful conversation you won't want to miss. So here's your host, Fred Kranz.
Joe, thank you for joining us.
Well, thank you, Fred. I appreciate it. I appreciate you making the time for me.
We've known each other for what, about 20 years?
Yeah, at least.
I think I've known you before you were at Piedmont.
Yeah. Yeah, absolutely. Yeah, I've been here 17 years.
Yeah, and Joe, for those of you out there who don't know, actually went to Piedmont on a consulting gig and never left. Is that right?
That's right. That's exactly right. It was when I started, I was about 6 months here, and the CEO at the time said to me, "You're not leaving." And I was like, "Yeah, I am. I got other work to do." And he was right. As it turns out, he knew what he was talking about. So,
but just for a few seconds. So you're from the north originally, right?
I am. I grew up in Providence, Rhode Island.
Okay, and you went down to the place that Sherman destroyed by bending the railroad tracks in the South. What kind of a cultural adjustment was that for you?
Well, honestly, before the bigger cultural adjustment was my first, when I was working for an outsourced supply chain company. Back then it was called Materials Management still. And they put me in Jennings, Louisiana, which was a small town population of 11,000. I had been in the South earlier out of the Air Force, or out of the high school. I joined the Air Force, and they stationed me in Biloxi, Mississippi. But that's different because on a military base, you have lots of people from different places. The base itself was one of the larger Air Force bases, so it was a very large community. First time I think I feel really what you would consider the traditional South was that gig for about 5 years in Jennings, Louisiana. And it's a great hospital, 49-bed facility, literally a gas food lodging stop off of I-10. But that was, I was actually telling the story earlier. One of my employees is actually leaving to go live in Rhode Island. And I was sort of preparing her for the cultural change. And I said, one of the things that it was interesting, you're having the reverse that I had, which is the CNO at this hospital said to me one time, after I'd been there about a year, she said, Joe, we like you a lot, but you talk too fast. So
you do. But you don't have a New England accent. You have more of a Chicago accent, really.
I've actually never really had much of an accent anywhere I've lived. Most of the time people are like, we know you're not from here, but we don't know where you're from. And some of that has to do with my dad. My dad being an actor, his whole life, Shakespearean actor and other things. He really frowned on not speaking correctly and using slang and other things. And so we even, Rhode Island has its own distinct accent as well. And
yeah,
my brother and I never really picked up that either. It was, everybody knows I'm not from here, but they don't know where I'm from necessarily.
There you go. So, as I said, recently, one of the giants of the healthcare supply chain industry, Bill McFaul, passed.
Yes.
I know he was a mentor of yours, and he was, he had a big hand in what we now call value analysis. And over the course of these podcasts, I have interviewed Barbara Strain and Bob Yokel, two other folks that are, sort of anchor points of value analysis. But why don't you, if you would, tell us about your relationship with Bill McFaul, what you learned from him, what his impact on the industry has been, and sort of how you've gone about applying that across your career.
Yeah, so not only was he a mentor, Bill was a very good friend and probably the single most influential person in my career, especially my early career. And he saw things, and it wasn't just me, but speaking about me personally, he sees things in people that they don't see themselves sometimes. And I was still early in my leadership career, actually working for a regional GPO when Bill and I met. And he was doing some work for for us as a consultant, and he and I really got along really well and have some very similar background in the way we came up, and we really bonded over that. And then I got to become very good friends with him, and his family is like second family to me. So I will try not to get emotional during this conversation, but professionally, he would give you tough love. Like he said to me one time, after we'd known each other for a while, and would tell him all the time about, like most young people, I want to do this, I want to do this, I want to do this, and he's like, well, Joe, look, here's the thing. You're never going to technically be the best supply chain leader, but you have the opportunity to be a good leader of people. And when you're young like that, you don't like to hear you're not going to be great at everything, right? I mean, you're not. But and I said that. I said, oh, in my head, I'm thinking he's wrong. I could be great at all of it. But he turned out to be some of the best advice I ever got, which is, as a leader, if you're not technically the best at it, find people who are, and surround yourself with people who are technically better and good leaders in their own right. But don't try to be the expert on, be it ERP systems or the best way to manage inventory or whatever the many aspects are of our career. And so I have really strived to surround myself with people who are both good leaders, but also technical experts that can enable whatever it is we're trying to do. Bill, he did that for a lot of folks. He did it formally. He did it informally. At his funeral, there was a lot of conversation. There were people that he'd worked with at McFaul and Lyons. Bill and Diane Lyons created the first true consultancy focused on healthcare supply chain. Before then, back when there was the big 6 firms or however many there were back then, in the 90s, 80s, and 90s, there was nobody who was specifically focused on supply chain and healthcare. And in fact, for the most part, most healthcare organizations weren't really that worried about, not the way they are today, worried about their expenses. And Bill brought from a concept that existed outside of healthcare, but had not really been a way we looked at it, which is value analysis. And now that's not the only thing Bill McFaul and Lyons did. They did a lot of great things, but the whole concept of value analysis into healthcare we owe to Bill McFaul and Diane Lyons. But this idea that you're going to actually come together, bring a group of folks together, and together decide what is the device that brings the most value. And we're going to look at it holistically. We're going to look at the clinical value. We're going to look at the financial value. And then we're going to, the way I describe it is, you may not always get what you want, but you're going to get what you need to do the job.
Someone should make a song about that. Maybe the Rolling Stones.
Right.
So let me jump in right here. Okay. I'm going to take you back to my start in healthcare management. I became the director of central processing and distribution at Baptist Hospital in Miami in 1973 when I was 27 years old. I had been in Vietnam. We had a product standardization committee, and it was not called value analysis, it's called product standardization. And for you folks out there listening in those days, and Joe said something a minute ago where he said in the early days, cost was not as big a factor of consideration in supply chain. That was because prior to 1983, healthcare was reimbursed on a cost-plus basis. So we were more concerned with getting all the revenue for items we charged for than we were for controlling costs. But I, being a young guy, thought, hey, what we use and how we use it is more important than how much we pay for it. So I was in this utilization thing, and we're in the product standardization committee. The model of those days was community hospitals. And if you're in Miami, if you're Baptist was in Kendall, Doctors Hospital was in Coral Gables, South Miami Hospital was in South Miami, and all 3 of those places had predominantly the same medical staff. So there was the independent practitioners in those days, and they could pretty much dictate what they want. So they all did get what they wanted. They got what they wanted when they wanted it, okay? And we, one year, spent a whole year trying to decide on exam gloves standardization. Right. Exam gloves, not surgeon gloves, exam gloves.
Right.
And I, as a young kid, made the mistake of saying to the doctors in one meeting, doctor, when I was in Vietnam, we did not know who made the exam gloves. They came in a wrapper that said FSN, which stands for Federal Stock Number, and then they had a dash and a whole bunch of numbers after this. And the doctor looked right back at me and said, "Son, you're not in Vietnam anymore."
Right.
And I go, "Okay, that's it." And that's the milieu in which you started and in which Bill McFaul started as he came in. So pick it up where I dropped off and tell us how things have evolved and how he evolved things.
Yeah, I think the interesting thing about the core idea behind value analysis or product standardization, I think sometimes that's what people think is the only goal is to standardize to a single product, and that's not, right? The goal of value analysis is to figure out what's the best way to get this product and financially get it in a way that, maybe a more expensive product, but how can we get it and utilize it and make sure that it's bringing the value that we think we should get, which is why it's called value analysis and not product standardization, right? You may land on, you're going to have all the vendors, right? You're just going to have a mechanism by which you're managing, okay, we're going to use the most expensive products only on these cases, right? And now it's called demand matching. I think it's all still value analysis. It's just it's a piece of the total value analysis puzzle. You know, I gave a talk to a group not long ago, and I said, I think the misconception about value analysis are a lot. And it's really the opportunity to get voices heard and then build consensus around what the right way moving forward is, balancing both the clinical need and the financial need. Today's environment, you cannot ignore it. I mean, you're right. When I started, Fred, I was at the tail end of that portion where you were still charging for bedpans because you could get paid for bedpans, right? And that doesn't, that's a long time ago. But I will tell you an interesting story that I learned. This is before I met Bill even, but is that those voices need to be heard. I remember as in that hospital in Louisiana, young, probably in my 20s. I think I was probably about the same age you were. And I said, I bought a different plastic product. So, the basins and the bedpans and all those. I just switched. And I came to work the next morning and there was a line of nurses outside my door waiting for me. And they were mad because I hadn't taken it. And I forget exactly why, but these new products were a different color. And they were up in arms because I had not consulted them before we changed the color. To me, it's like, what do you care? It's a bedpan, right? You know what they're used for, right? But it matters, right? And that was a valuable lesson to me because it was a valuable lesson that you want to let people have a voice. It was really more about this change happened and nobody had told them and nobody had consulted them. And they honestly, at the end of the day, only cared more about the way the change happened versus the actual change itself. So those valuable lessons you learn about including people in the conversation and having them become advocates. So it's not the supply chain guy saying you can't use your product. It's your peer saying, no, we made an informed decision and together we decided to make this change happen. I think too often value analysis now is also confused with new product reviews. And I think, as an industry, I'm going to say this, I'm not going to make a lot of friends, but I think sometimes we have to have some intestinal fortitude and just look a doctor or a vendor in the eye and say, no, we're probably never going to use your device here, as opposed to saying, well, it has to go through the value analysis committee, or it has to go through this product or committee or whatever, or blame it on the GPO. Well, you're not on the GPO contract, right? And no, that's why we get value analysis confused with other things. Value analysis really is meant to be a place where you bring a cross-section of people together to discuss the change that makes the most sense for the organization. Oftentimes financial, this is true, but also when you're talking about clinical outcomes. And we align that very closely with our clinical resources here. And they feel included in the process. And I'll give you a quick story. We did it, my early days here, we did a lot of work. Piedmont probably has one of the best heart programs in the country now. And early on, I worked very closely with the leaders in that area as they started to create the program. And we were trying to both bring in this cutting edge technology at the same time managing the cost around the entire program. And we've been working together several years. I was at a conference and one of our physician leaders called me and said, Joe, one of our doctors just called me up in arms because his rep told him that you were going to make everybody change and you weren't going to tell anybody. And I said, what did you say to the doctor? And he said, well, I told the doctor Joe would never do that. And then I said, well, okay, why'd you call me?
Just wanted to make sure I was right.
But that's where you want to get, right? You want to get where there's a level of trust that, and they're included in the process, so they know that if somebody says, well, so this change is happening and nobody told us about it, the folks say, well, that's not true. It's a change that we all decided to do together. And Bill brought that concept. Before then, that wasn't the concept, right? It felt either physicians decided what you were going to use, clinicians decided on their own, and basically you bought it, or administration did things by dictate, right? And I feel like while there are still organizations where that may feel like how it's working, the high functioning organizations haven't done it that way in years. And that's part of, I think that's a legacy. That's one of Bill's legacy. The other is the number of leaders that, I mean, I'm sure, I'd be surprised in your conversations with Barbara and others that Bill's name doesn't come up at some point. Yokel, I think Yokel did a lot of great stuff, has done a lot of great stuff with value analysis, but I think he also recognizes that exists because of the work Bill did. He was genuinely, he could be tough and he could be relentless when it came to driving a need for change, but he also understood the value. I worked with him on a special project for a few years when he retired, when he was thinking about potentially coming out of retirement, but he'd become very interested in change management and what it takes to change cultures and what it takes to change people. And he started talking about a concept of, instead of a materials manager or a supply chain VP, having an executive for all things expenses and having a person. And I think that's what these roles have morphed into. I know here at Piedmont, supply chain is much more than just dealing with supplies, right? I mean, that's the core function, but we get involved in much more than that and have essentially become internal consultants to the organization. And we apply that value analysis idea to all the things. It could be an IT tool, it can be a purchase service, it's still the idea of being inclusive in the way you're making a decision. Doesn't mean you're not challenging people, doesn't mean everybody's going to walk away with their favorite vendor or their favorite product winning, but it means everybody felt like they had a voice in the process, and then you get even greater support after you've made the decision.
Before we dive back in, you may be asking yourself, is my supply chain future ready? At St. Company, we don't just optimize logistics, we engineer smarter, leaner, and more resilient systems from end to end. From manufacturing to retail to healthcare, our experts bring decades of experience and cutting-edge strategies to transform your operations. Visit and discover how we're shaping the future of supply chain, one solution at a time.
They're just implementing a process. If you look at, you've been fighting this fight for a long time, and the other day I was talking with our mutual friend Ed Hiscock, and Ed brought up something a long time ago that I remembered and wrote down. In healthcare, we don't have a single supply chain. We have a whole bunch of niche boutique supply chain.
Yep.
Any discipline has its own supply chain, and along with that comes the influence and the attempted leverage of the directors or the doctors or the clinicians that are responsible for managing that discipline. And that can even go into facilities and other places. Wherever there are things needed, there are people that think they know about these things better than anyone else. And rather than applying a methodology with responsibility for certain aspects taken care of, they want to do it themselves. I'm sure you experienced that when you came to Piedmont.
Yeah, I call it the shadow supply chain, right? And the shadow supply chain are areas that manage, in some cases, very expensive devices, not all, but very expensive products, and really don't have professional supply chain training, and so their priorities are just different, right? In the shadow supply chain, you'll find that it's more about never run out, always keep the doctors happy, right? I mean, it's just a function of their role, which primarily in some cases is clinical, and then they do this as a side hustle, right? And I think what we've done is try to embrace that shadow supply chain and educate them on the other aspects of what you should be looking at. I mean, in the shadow supply chain is where you see a bunch of obsolete stuff because the doctor changed their mind or a new doctor came in, and so they just it's additive. It's almost rarely deductive. And and it's because you're really just focused on keeping the shop open and keeping the doors on. And what we say is, let us do that other aspect for you. Let us partner in that. And my promise is we're not going to let you run out. right? But we're also going to ask them questions like, okay, doc, you said you want to use this instead. What about the 6 month supply of product we brought in for you before? I need you to do something with this before, right? And having those kind of conversations and being specialists. I want clinicians to be clinicians, right? We have such a shortage of nurses and specialists right now and doctors, and I don't want them worried about supplies. I just want them to feel like it's there, right? They just show up and the stuff is there, and if it changes, it's not a surprise because they've been well informed as to what the change is. I think that alignment is, there's the official value analysis meetings, and then there's the day-to-day value analysis of those conversations, right? I talk to our frontline employees all the time, and I have I think we have like 800 team members now across our 24 hospitals, and my commitment is that I will meet all of them either virtually or in person in their first 30 to 90 days. And one of the things I say, especially to the frontline, is for most of these folks, you are supply chain. They may never get to meet me. We have 40,000 employees at Piedmont now, right, across huge geography. I would like to meet everybody, but I probably won't. So the day-to-day, the person restocking those shelves, that is supply chain to them. And I want that person to understand why the change is happening too. I want them to be able to explain what's going on. I want them to be able to raise their hand and say, hey, the docs aren't happy about this, and let me tell you why. And to me, that's part of that trust and relationship building that we talk about, right? Where you get, and that's where the rubber hits the road is. And they're also the ones who have to explain when there's back orders, and they're the ones who have to explain when there's a challenge with products, and they get to get beat up on, even though it's not their fault, right? And I often, but to me, that's all part of value analysis, is that inclusiveness and that education and making sure everybody understands what we're doing, why we're doing it, and then feels ownership, right? I mean, I will say that I noticed with physicians, the most recent generations, their understanding of the financial aspects of it are much greater. And I don't know if that is what's going on in school, or they just care, or they realize they can't not care about it, the way maybe some of the older physicians used to be able to just come in and say, I don't want to hear about the numbers, I just want to take care of patients, right? That's just not the world we live in anymore, right? But yep. In both cases, they want to be part of the process. They want to know what's going on.
So are your physicians individual practitioners, or are they employees of Piedmont?
Both. We have both.
Yeah. Because, really, when you look at the clinics, the Mayo Clinic, the Cleveland Clinic, and Marshfield Clinic, any place that's got the word clinic in there,
right.
It's usually owned by physicians, and those guys were always aware of what the decisions meant to their pocketbooks. So that they were sort of leaders in standardization, leaders in these process, because it was meaningful to them. Whereas in the traditional standalone community hospitals, you had individual practitioners. So you've been there 17 years.
Yeah, what's interesting? I just want to finish the thought about Bill.
Go ahead.
The other thing that was great about Bill is, sometimes you see that somebody comes up with a really great idea, and then they hang their hat on that for the rest of their career. Bill was always in flux. Bill was always trying to figure out how you could make it better. He was a rabid reader. Always wanted to know what was going. Even after he retired, always wanted to hear about how it was going, what was going on. Would always come up with different ideas. Was not afraid to have his original ideas blown up or challenged, and just really. I think that is one of the things I strive for as well. I'm not always good at it, but one of the things he instilled in me is don't get stuck in one way of doing things, and don't be afraid to listen to other voices, and change when necessary, or modify what you're doing. And I've said that is one of the reasons I say when people, I've built the supply, we have built the supply chain at Piedmont that Piedmont needs for their vision, mission. I might build a different one if I was at a different health system, based on what their mission is, based on what their goals are, based on what their philosophy is. But I think that willingness to change, and I think most importantly, and Bill was very successful and smart and had an ego like the rest of us. But I think the other thing is, don't ever let that be the thing that, I'm not building the Joe Colonna supply chain. I'm building the Piedmont healthcare supply chain, right? Yep. It's not mine. I have the privilege of leading it, but it's not mine. I'm building a supply chain for Piedmont Healthcare to support what they're trying to do. And if you ever get out of that zone where you think it's about you, you probably need to move on.
Oh yeah, and the organization needs to move on from you. I can say that when I was working with Tom Hughes at BD Healthcare Consulting or Concepts in Healthcare, when I was working with Capgemini, Accenture, we did what probably you're talking about all expenses. We did non-salary expense reduction projects.
Yep.
Okay, but I would say that 70% of the stuff that we found and identified and got organizations to implement had already been identified and attempted to be told to the leadership by the people that had worked there for years and years, and they had just been ignored.
Yep.
The people had not been included in the process, and it was almost like stealing money.
Yep.
I would make it a point in my presentations, if somebody told me something, to tell them where I got this from, because I think the people needed to be recognized for it. Hey, you weren't listening to them. You're paying us big money because you weren't smart enough to listen to people you already had. And I think what you're talking about, what Bill McFaul was talking about, is encourage people to speak up, not to be afraid of you or intimidated by you. And if you do that and you apply the processes that you've talked about for formal value analysis, you're going to have some pretty good outcomes.
Yeah, agreed. I think, what's the old joke? And you were a consultant, I've been a consultant. It's the old joke of, what's the definition of a consultant? Somebody that looks at your watch and tells you what time it is, right? I mean, that frustration still exists. I've seen it in other aspects, in other ways, and it really is. There's nothing worse than sitting in a room and having somebody present your idea like it's theirs, right? I mean, there's just no worse feeling.
Yeah, that kills me. I've seen so many guys at the big meetings, and the one guy that I always admired, and this is off the subject, and we'll wrap it up here in a minute, but I always thought Bob Simpson did a good job of identifying his people and pointing them out who had come up with ideas. And Bob Simpson was a big personality and large person in our business, but he knew the importance of the people that he had working with him.
I think if I was to, if a thought I want to make sure that we talk about with Bill especially, but Bob and others, is, there was the concept of the idea that there would be an executive role in supply chain in a healthcare system or a hospital was nowhere on the radar 40 years ago, right? Nowhere on the road. When Bill started going out and others, I stand firmly on the shoulders of Bill and Bob and others. And my hope is that my shoulders are broad enough that the next generation stands on mine. And I'm doing things that they couldn't even think of, right? They were still knocking out Nick Toscano is another one, right? He was in the early days. He and Bill and others probably created the early stages of what we now see as the GPOs, right? They were involved in some of those conceptual ideas. The first distribution centers where hospitals would own their own distribution center. Just in time, right? Or what became stockless, the Ted McFaul or the Ted Almonds at Claflin, who were the first ones to bring that idea of a stockless to those. All of those things didn't exist when I started, and the idea of them, and then those of us who got the privilege of now leading at an executive level in an organization that fully embraces the concepts of value analysis and the value of a high functioning supply chain team, that's directly credited. We have to credit Bill and Bob and others and Barbara and others that we stand on their shoulders. And my job now, I've got probably 10 years left, is to make sure that I help the next generation. And I don't just mean in hospitals. I mean on the vendor side too. I'm starting to engage more with the vendor leadership and saying, I don't want to meet with salespeople much anymore. I want to meet with operations people. And how do we take that next level leap of how do we make each other mutually more efficient? Ed Hiscock's comment about the multiple supply chains is spot on, but it doesn't have to be that way, right? I mean, there's all this technology that didn't exist that's available to us, right? There's new ways of looking at the work. And I see the kids come. I say kids, the 30-somethings coming up, and they're challenging everything. And I remember doing that when I was 30, in my 30s, and I'm more than happy to be challenged. And but all of it ultimately sits at the feet of Bill and others who challenged the norm and challenged the way things were looked at, and really have made a real difference in a lot of people's lives and the business
Yep.
as a whole.
Well, Joe, I think we're sort of winding to the end of our time, but I would characterize the way you talked about what Ed said is, instead of having multiple supply chains supporting multiple disciplines, have one really excellent supply chain supporting multiple disciplines with the input from those disciplines.
And I would, the one thing I'll close with is, let's not forget to recognize the team members who are doing that work. And the reason I say that is a really high functioning supply chain, for the most part, is invisible to the clinicians. When I talk to young talent coming up and they want to work in supply chain, I say, okay, but you recognize that if you're looking for daily affirmation, supply chain is not for you. Right? It's more often you recognize when something breaks than the day-to-day. And the example that I'll give to non-supply chain people is, if you stay at a hotel and you stay overnight and the next day you go out and do whatever and you come back, if the room is immaculate, how often do you call housekeeping and thank them? But if it's a mess, you're on the phone in a heartbeat, right? And so what I tell them is, you should take pride in the phone call that doesn't come.
Yeah, you're right. And how often, do people stay in hotels and never leave a tip, or never tip the folks that take care of them?
Well, you want to freak them out, call them and say thank you. Like, perfectly clean room, just call them and say, I just wanted to say thank you. And they're like, are you kidding? Are you being sarcastic? Like, no, I legitimately just wanted to say I appreciate the good work that you've done.
Absolutely. Well, Joe, it's been a pleasure having you on the podcast. We have to get you back. Have to get you back again, because as I told you earlier today when we were just talking, I'm writing a series on what the winning supply chain needs to look like, and I think you probably have a lot of good ideas that I need to ask you about, and some pearls to put in there.
I'll let you know when I figure it out.
We're talking about when we were young. I had a couple of friends that are really good friends of mine. One of it was a guy named Jay Mitchell, who's passed recently.
Oh, I know Jay.
And I told people, I said, I've known Jay since 1983. I said, I couldn't stand the guy when I met him, because he thought he knew everything. And how could that be? Because I did.
Right.
And as we grow older, we realize how little we really know and how much we need to draw upon others, and how folks like Bill McFaul and the people we've talked about have done so much and deserve so much respect and recognition for what they've done. So thank you for talking about Bill. Thanks for being here.
Absolutely. Thank you, Fred. This is great stuff. Keep it up.
Well, that's all for today. Thanks so much for joining us, and don't forget to hit that subscribe button and connect with us online so you'll never miss an episode and can catch up on all the ones you might have missed. Got a topic you're fired up about, or maybe you want to be a guest on the show? Fred would love to hear from you. Just reach out at fcrans@stonge.com. We'll see you next time.